point number one, all special education disabilities, all mental health diagnoses are professional opinions. They are not scientific facts. I need your parents to understand that. When someone says your child has a math disability, reading disability, emotional disturbance, ADHD, intellectual disability, those are not facts. They cannot be verified scientifically. They are professional opinions. That's number one. Number two, a child, the more difficult you can prove to the younger the child, the more difficult it is to prove the disability. Number three, the younger the child, the more likely the disability determination will be inaccurate. If I'm diagnosing a 3-year-old, a 4-year-old, a 5-year-old, a 6-year-old, there is high probability that my conclusion is incorrect. With those three facts having now been to answer the question, when you should get a child evaluated, you should never get your child unless they meet three conditions. Condition number one, the child is not in the 3rd grade or younger. I have a big problem, a serious problem, evaluating 3rd graders, 2nd graders, 1st graders, kindergartners, and for reasons already mentioned. They are too young for me to conclusively determine if they have a disability. They are also still developing. Young children will develop and grow by leaps and bounds. The best thing we can do is give them time to grow and mature academically, behaviorally, and intellectually before we start slapping labels on them. So number one, 3rd grade and younger, don't evaluate. Number two, only evaluate if you, the parent, believes something is wrong with your child. You don't sign permission to have your child evaluated just because the teacher wants it done. Black parents have to stop evaluating black children just because white people want them tested. That is a very big mistake. Number three, do not get your child evaluated for a learning disability when you know that both you as a parent and or the school have failed to give that child an adequate education in the first place. Too many children are being labeled as learning disabled who are not learning disabled. They have skill delays, delays that would not exist if their parents reinforced academics at home and if they went to a school that gave them strong instruction in the first place. Too often, the child is blamed for problems that were created by parents and teachers.
Wow, that's very powerful, Dr. Umar. Just to recap, one of the things that you said, I'm just going to recap for other listeners. One of the things you said, if the child hasn't been diagnosed yet, if that child is on the 3rd grade or lower, that child should never be, diagnosed by any professional. And then, and second, you said if by any time the child should never be attested, except if you know for sure, not what somebody tells you, but if you know for sure something might be wrong with the child, then you might consider doing that approach. Is that correct? Hello?
Sorry about that.
Yes, sir. What I was saying, I was recapping what you said in terms of the when to diagnose or not diagnose. Like you were saying, if the child is on 3rd grade or below, that child should never be diagnosed for any type of disabilities, or if only if the parent for sure, for himself or herself, know that child is something is actually wrong with that child, seriously wrong with that child, then they could consider doing that. Is that correct?
Absolutely correct.
Okay. Now, what happened to a parent? Let's say they already go through that process. For instance, they have a child who was diagnosed at the age of 2 years old with autism. Right. So they put them in that special program, EIP program, I believe, and so now that child is there, and then now the parents see so much improvement. The child's reading by himself. There's no learning ability in that child at age 5. From 2, they diagnose and still in the program, but the child is excelling in everything that he or she is doing. But now it's a challenge for them to remove the child, because now they after the parents sat down with the school, now they want to put that child on Gen Ed, but still and with the EIP, just in case if he needs assistance. Would you recommend, or is that a good recommendation to still have the child in Gen Ed and then still be on EIP?
Okay, good question. A couple of points. Number one, a child cannot qualify for special education unless they have a disability. You must have a disability in order to qualify for special education. There are 13 federally defined special education disabilities. The most popular are autism, emotional disturbance, the learning disability, intellectual impairment, speech and language impairment, deafness, blindness, traumatic brain injury, orthopedic impairment, multiple disabilities, other health impairment, and there's a few others, but those are the 13. Now, you mentioned autism. Autism is real. Autism is very real. And the reason why so many black children are coming down with autism is because we are giving our children these immunizations that are very toxic to the developing brain of African children, which is why I often encourage parents not to immunize your children if you can help it.
That's very important. That's very important.
Absolutely very important. Now, it can be difficult to avoid the immunizations depending on where you live. There are 18 United States that allow you to opt out of immunizations for philosophical beliefs. In other states, you either have to have a medical exemption or a religious exemption. I live in Pennsylvania. In Pennsylvania, you have religious exemption, medical exemption, but you also have philosophical exemption. So in Pennsylvania, all you have to do is write a letter to the school, getting it notarized, stating that you don't agree with immunizations, and your child can proceed with their education. I'm not sure about Florida. I would need to check. With that being said, autism is real. However, as I stated earlier, it is still too early to confirm an autism diagnosis for a 2, 3, 4, or 5-year-old child. A child with a speech impairment could look autistic. A child with social anxiety could look autistic. A child with selective mutism could look autistic. A child who has been sexually, verbally, or physically abused could look autistic. There is a lot of conditions that can present and mask themselves as autism that are not autism. Remember, there is no cure for autism. There's no cure for autism. So if there's a cure for autism, why rush and get a kid diagnosed at 3 or 4 with autism when you waited until they were 6 or 7 to make sure the diagnosis is accurate? Or be diagnosed at 6, it's not going to make a difference because there's no cure. It's not cancer. It's the flu. The earlier you get it, the quicker you can eradicate it, the can control it. Not true at all, because there's no cure for autism. If you diagnose a black child too soon, autism and subject them to of low expectation vis-a-vis special education, the harm that's done to that child, socially, academically, and intellectually, just slow down, understand, and do not solve problems. I repeat it again. Diagnoses do not solve problems. It's better to take your time and get it right. Wrong. You must remember, special education is part of the school to prison pipeline, and rarely does that benefit our children.
Now, if a parent already have that child vaccinated and showing sign of autism and so on and so forth, and now that child is in the system already, and but academically speaking, that child is doing well. So should we have them in the Gen Ed and still in the EIP program, or revoke EIP and then still knowing that they have autism and keep it on Gen Ed since they're doing well? What is your suggestion to that?
Good question. I want to go back to something I said earlier. In order to qualify for special ed, 2 questions must be answered positively. The first question is whether or not the child has a disability. We can answer yes to that question, assuming they were accurately diagnosed with autism. So question number 1, does the child have autism? The answer is yes. But that is not sufficient to qualify them for special ed. We now must answer the second question. What is the second question? The second question asks, does the disability affect that child's ability to learn in the regular classroom? Let's go over this again, because I need your parents to get this. It is simple, but it is very important, and it is often misunderstood. Number 1, do they have a disability? Yes, they do. My child has autism. Okay, fine. But that is not enough to qualify for special ed. Question number 2, does your child's autism affect their ability to learn in the regular classroom? If you say no, if you say my autistic child can learn in the regular class as well as other children, that child cannot go to special education. Let me give another example. Let's say you say my autistic child has trouble adjusting in the regular class. But if they sit at the front of the class, or if they sit close to the teacher, or if they sit with a certain classmate, they can be successful in the regular class. So then guess what? You just told me that they don't need special ed. All they need are accommodations. And if all they need are accommodations in the regular class, they can get that through a plan called the 504 Accommodation Plan. Your parents need to understand that the IEP plan is not the only plan that exists to help a child. There is a 504 plan that is not special education, that if the child has a disabling condition, in this case autism, they can be given accommodations in the regular class so they can be successful without special education. Accommodations include things like extra time to take their test, a one-to-one aid, regular breaks from the classroom, school counseling, any type of accommodation they need to be successful. If that is all they need, they don't need special ed. All they need is a 504 plan. Special education is only, absolutely only, if the child cannot learn in the regular class. I have evaluated hundreds of autistic children. Some of them needed special ed because they were not able to learn in the regular class because their autistic symptoms were so distractible that they were losing ground. Other autistic kids might have needed some accommodations. Other autistic kids didn't need accommodations or special ed. So you had three options. One option, leave them in regular class with no support. That's option number one. My child doesn't need special ed, and they don't need any accommodations. So that kid goes into the regular class. Conversation over. Next kid doesn't need special ed. They can learn in the regular class, but they need accommodations. So they stay in the regular class. They get a 504 plan. They get accommodations. Only student number 3, who has the autism and whose autism is affecting their learning, only if it affects your learning can you qualify for special education.